Magda Mensi. I'm a periodontist and I work in Italy at the University of Brescia, a little city close to Milan. And my main topics in the research and in my clinical activity are the non-surgical therapy in terms of treatment of severe periodontitis with or without supplements like the systemic antibiotic, topical antibiotics, photodynamic therapy, probiotics, and the therapy of and treatment of the biological complication around implants, so mucositis and periimplantitis. In a non-surgical point of view and in a surgical point of view when the non-surgical treatment is not efficient, and there are some cases where we need to combine the two approaches, non-surgical and surgical. And I worked in the soft tissues management around implants, and I have many randomized clinical trials around these five fields. And of course, I teach at my university to both courses for dentists and for dental hygienists, and I give many lectures in Italy and abroad around these topics. And this is my friend, Diego Lops, and I work with him in other approach, a combined approach. And so, please, Diego.
I'm Diego Lops. I teach prosthodontist in University of Milan and Shanghai Jiaotong. I'm mainly focused on the treatment of restoration of both natural teeth and implants related to the surgical and prosthodontics and soft tissue management related to high demanding cases in anterior areas. I do this in the university and in the courses and activity of education in Italy and abroad. And the specific link with Magda is dedicated to create a spatial format that can start from the correct diagnosis and intersective activity of the right candidate for implant dentistry patient and follow him to the right rules about surgery, prosto, perio, and dental technician skills put together in order to create something predictable and aesthetic linked together in order to be in a long-term therapy efficient.
Because they told about me that I prevent the periimplantitis. I need to prevent the periimplantitis, but I think, as I told Diego, that he prevents the periimplantitis with the planification of the case and with the right position of implants and management of the prosthodontics. And then we can prevent the complication with the maintenance and with the right primary and secondary prevention. So I think that we can show very global approach in terms of biological and aesthetic.
Because what we did is not only what we can show, good cases, good outcome, but also something different. So, to summarize, we will discuss about biological and histological aspect to be known for understanding why biological complications happen and the respective therapeutical strategies with the respective prognosis. And more in detail, we can discuss about diagnosis of mucositis, diagnosis of periimplantitis, combined non-surgical approach, surgical approaches, surgical planning in order to be good, connection, biomechanics, prosthesis selection, aesthetic emergence profile, transition zone management, material of choice, and soft tissue augmentation. And to conclude, is a recipe to prevent a peri-implant problem, detect it in time, and treat it effectively.
Even that, is it possible to share together and we can do together the right tools and the right recommendation in order to achieve a predictable aesthetics